Hello students, today we will discuss about fever. The topic seems simple. First we will go to the terms. What do you mean by some terms? You will first draw a line, okay? Now 95 degrees Fahrenheit, 98 degree Fahrenheit, 99 degree Fahrenheit and 106.7 degree Fahrenheit. So any temperature less than 95 degrees Celsius, 95 degree Fahrenheit, what do you know? What do you call it? You call it as hypothermia. Okay, hypothermia. In 95 to 98, if the temperature of the patient is between 95 to 98, you call it as subnormal. Okay, 98 to 99 is the normal temperature of a person. More than 99, you call the person is febrile. Okay, and what do you say for more than 106? You say the person is hyperpyrexia. Hyperpyrexia. So in it out, these are the some of the terms which we should know before learning into the terms of fever. Now we'll discuss about two types. One is low grade fever, okay, low grade fever. Other one is high grade fever. When do you say a person is having a high grade fever? When a person comes to you, how do you measure high grade? He will say specifically he is having chills and rigor. Why does chills and rigor occur? As soon as the temperature rise of the patient, the peripheral vessels constrict. Okay, so what does happen when a peripheral vessel constrict? It causes the patient to conserve heat. Okay, so as a result of which he feels chills with rigor. Then low grade fever. Low grade fever, what do you mean? The patient is having fever throughout the day. Normally there is a circadian rhythm. Circadian rhythm means morning the temperature is very low. At 6 a.m. the temperature is around 37.2 degree Celsius, whereas in evening you can say at around 4 to 6 p.m. yeah, the temperature is around 37.7 degree Celsius. So this is the normal circadian rhythm. A difference of 0.5 degree Celsius is there between the days. So if a person is having a person feels that he is having an evening rise of temperature. Evening rise of temperature. Why do you say that? If example, evening rise of temperature, it is characteristically seen in TB. Okay, so what does that mean? He doesn't have temperature not on the day. No, he has the temperature over the day, but it will be 32.7 plus 0.5. It will be around only 33 or 34. Okay, so he doesn't feel a temperature because it's within the normal limits, even though there is a temperature rise. However, even in the evening, when the base temperature is around 36.2, okay, when there is around 36.7 and the base temperature is increased by more than 0.5, then he feels fever. Okay, so in that case he says that he is having an evening rise of temperature. Why does an evening rise of temperature occur? Evening rise of temperature occur because there is low steroids, as a result of which low steroid evening, and so there is increased pyrogen activity. Okay, now we'll discuss about the types of fever. what are the types of fever? Okay, first we'll discuss about intermittent fever. Intermittent fever. What do you mean by intermittent fever? First of all, intermittent fever is a type of fever in which the fever touches the baseline and then rises up. This is known as the intermittent type of fever. There are three types. One is the quotidian fever. Okay, quotidian fever. Then what is the second one? Second one is tertian fever. And what is the third one? Quartan fever. Okay, don't forget what I am saying. Now, what do you mean by quotidian fever? What do you mean by quotidian fever? Quotidian fever means his fever spikes fluctuation in a day. It occurs one spike per day. It occurs throughout the day. Examples are he will have a bivax, okay, with falciparum combination. If a patient has a vivax malaria with falciparum combination, he will have a quotidian fever. Whereas tertian fever, as the name suggests, fever every third day. Fever every third day with an interval of 48 hours. That example is vivax, classical example. Okay, it can be falciparum also. Then and what about the quartan fever? Quartan fever is once every 72 hours. After once every 72 hours. So example is P. malariae, Pulmonary malaria. It is not common in India. Then what do you mean by quotidian fever or a camel hump fever? Why do we say that? That is, he has two spikes in a day. Okay, it touches the baseline and two spikes in a day. Where do you see this case? It is seen in visceral leishmaniasis. Okay, and second one is adult onset Still's disease. Then third one, very important, endocarditis. Endocarditis due to what? Specifically due to what? It is due to meningococcal. Okay. Now, coming to the remittent type of fever. What do you mean by remittent type of fever? Remittent type of fever means a fever rise of more than 2 degrees Celsius or 3 degrees Fahrenheit and not touching the baseline. Not touching the baseline. What do you mean? What are the examples? One is cortical vein thrombosis. Okay. And other one is what do you mean? What are the other one? MEB cleaver abscess. MEB cleaver abscess. Then miliary TB. These are other examples of remittent fever. Then continuous fever. What do you mean by continuous fever? The fever is not more than 1 degree Celsius and not touching the baseline. Okay. Then what are the examples? It can be lobar pneumonia. And other examples is miliary TB. Okay, that's it for now.